How to reduce fatty liver naturally. Diet and lifestyle strategies to reverse non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease, NAFLD, is a growing health concern worldwide, but the encouraging news is that it can often be reversed through natural, evidence-based methods. Central to these strategies are improvements in diet, exercise, and alcohol consumption habits. Understanding fatty liver disease. Fatty liver disease develops when excess fat accumulates in the liver. This condition can stem from a variety of causes, including obesity, type 2 diabetes, excessive alcohol intake. There are two main types of fatty liver disease: alcoholic fatty liver disease, AFLD, non-alcoholic fatty liver disease, NAFLD, also referred to as metabolic dysfunction-associated steatotic liver disease, MASLD. For individuals with AFLD, completely eliminating alcohol is critical. In contrast, those with NAFLD, who may consume little or no alcohol, should still consider reducing or abstaining from alcohol to support liver function and prevent disease progression. Lifestyle risk factors and disease progression. A high-fat diet and sedentary lifestyle are among the leading risk factors for developing fatty liver disease. Over time, untreated NAFLD may progress to more serious liver complications, such as inflammation, fibrosis, or cirrhosis. Fortunately, targeted lifestyle changes can support liver regeneration and reduce liver fat levels significantly. Natural ways to reduce fatty liver. Key strategies. If you've been diagnosed with NAFLD, your healthcare provider will likely recommend a comprehensive lifestyle approach. Below are 3 core strategies to reduce fatty liver naturally. 1. Alcohol reduction or elimination. The liver plays a central role in processing and eliminating alcohol. Even moderate alcohol intake can place additional stress on the liver, especially in individuals with NAFLD. Reducing or avoiding alcohol altogether can ease the burden on your liver and support healing. The Centers for Disease Control and Prevention, CDC, defines moderate drinking as up to 1 drink per day for women, up to 2 drinks per day for men. To provide context, 1 standard drink is equivalent to 12 ounces of beer, 8 ounces of malt liquor, 7% alcohol, 5 ounces of wine, 1.5 ounces of distilled spirits, e.g., gin, rum, vodka, whiskey. However, for those with alcohol use disorder or individuals who struggle to limit consumption, even small amounts of alcohol may be harmful, both mentally and physically. 2. Dietary changes to support liver health. Obesity is a significant risk factor for non-alcoholic fatty liver disease, NAFLD. If you are overweight or obese, even modest weight loss, around 3% to 5% of your total body weight, can help reduce fat accumulation in the liver and decrease liver inflammation. Adopting strategic, sustainable dietary changes is one of the most effective ways to reduce fatty liver naturally. Below are key evidence-based recommendations. Focus on healthy fats. Limit overall fat intake according to recommended daily guidelines. Avoid harmful fats, particularly saturated fats, found in red meat, full-fat dairy, and processed foods, and trans fats, found in many baked goods and fried items. Prioritize unsaturated fats, such as those found in omega-3 fatty acids, nuts, avocados, and extra virgin olive oil. These fats are liver-friendly and may reduce liver fat levels. Control carbohydrate intake. Excessive carbohydrates, especially refined sugars, can increase liver fat. Refrain from consuming sugar-sweetened beverages, desserts, candies, and processed foods high in fructose or simple sugars. Emphasize whole grains, legumes, vegetables, and low glycemic index foods to manage blood sugar levels and support liver health. Weight loss at a safe pace. Gradual weight loss is essential. Losing weight too quickly can actually worsen liver function. Health professionals generally recommend aiming to lose 1 to 2 pounds, 0.5 to 1 kilogram, per week. Adopt the Mediterranean diet. The Mediterranean diet is frequently recommended for individuals with NAFLD. It emphasizes fruits, vegetables, whole grains, healthy fats, lean protein, especially fish, and minimal processed food. This dietary pattern supports liver health and overall metabolic function. Before starting any weight loss program, consult a healthcare provider to determine a safe and personalized plan based on your medical history and individual needs. 3. Lifestyle changes and physical activity. Incorporating regular physical activity is a key component in reducing fatty liver naturally. Exercise, even without dietary changes, has been shown to lower liver fat and inflammation, which are central features of non-alcoholic fatty liver disease, NAFLD. Benefits of exercise for liver health. Engaging in both aerobic exercise and resistance training provides measurable benefits for individuals with NAFLD. These forms of physical activity help improve insulin sensitivity, promote fat metabolism, and reduce the buildup of liver fat. A 2018 systematic review found that moderate-intensity exercise, even without accompanying dietary changes, led to a significant reduction in liver fat. Moderate exercise was defined as 20 to 60 minutes per session, 4 to 7 days per week, or a total of 200+ minutes per week. These findings highlight that consistent physical activity, regardless of duration, can yield tangible improvements in liver health. Clinical evidence of effectiveness. A 2013 study involving 154 individuals with NAFLD demonstrated the powerful synergy of lifestyle interventions. Participants who adopted a structured program of diet and exercise saw a 64% remission rate in fatty liver disease, emphasizing the importance of comprehensive lifestyle changes. Creating a sustainable exercise plan. To support liver recovery, aim for a balanced exercise regimen that includes aerobic activities such as brisk walking, cycling, swimming, or dancing. Strength training using weights or body weight resistance exercises. It's important to start gradually and build consistency over time. Always consult with your physician before starting a new exercise program, especially if you have existing medical conditions. Frequently ask questions about reducing fatty liver naturally. Are there any medications that help clean a fatty liver? At present, there are no FDA-approved medications specifically designed to treat or reverse fatty liver disease. Some research suggests that vitamin E supplementation may reduce liver inflammation in certain individuals, but this approach carries potential risks and side effects. As a result, most healthcare professionals recommend lifestyle modifications, particularly improvements in diet and exercise, as the most effective and safest way to reduce fatty liver naturally. Importantly, the liver is responsible for metabolizing many medications. Overuse of certain drugs, particularly acetaminophen, paracetamol, can place additional strain on the liver and potentially worsen liver damage. Always consult your healthcare provider before taking any over-the-counter medications or supplements, especially if you have been diagnosed with liver disease. How long does it take to reverse fatty liver disease? The timeline for improvement depends largely on the underlying cause and your adherence to lifestyle changes. If fatty liver is alcohol-related, improvements may occur within approximately 2 weeks of complete alcohol cessation. In cases of non-alcoholic fatty liver disease, NAFLD, recovery depends on the pace and sustainability of weight loss. Research indicates that losing 7% to 10% of your body weight safely can lead to significant reductions in liver fat and improvements in liver function. However, losing weight too quickly can be counterproductive and even harmful. Aim for gradual, steady progress under medical supervision. Because fatty liver disease is often asymptomatic, also known as a clinically silent disease, you may not feel noticeable changes as your liver improves. Routine monitoring through blood tests or imaging studies may be necessary to track your progress. What happens if fatty liver disease is left untreated? Untreated fatty liver disease can have serious health consequences. Over time, it may progress to more advanced conditions such as liver fibrosis or cirrhosis, liver cancer, hepatocellular carcinoma, increased risk of cardiovascular events, chronic kidney disease. By taking action early and adopting a comprehensive approach to natural fatty liver reduction, you not only support liver health, but also lower your risk of long-term complications and improve your overall quality of life. Takeaway: how to reduce fatty liver naturally and improve long-term health. Reversing fatty liver disease requires a commitment to long-term dietary and lifestyle changes. These include achieving and maintaining a healthy weight, adopting a balanced eating plan, staying physically active, and limiting alcohol intake. Together, these actions help reduce liver fat, decrease inflammation, and prevent disease progression. Improving liver health naturally does more than protect your liver. It also supports better overall metabolic health, helping to lower your risk for type 2 diabetes, heart disease, and other obesity-related conditions. If you suspect you may have fatty liver disease or are at risk, it's essential to consult with a healthcare provider. A personalized treatment plan can help you safely reverse the condition and protect your long-term health. Want to learn more about reversing chronic health conditions naturally? Subscribe to our channel for doctor-approved tips on nutrition, liver health, and more.